I'm here in Santa Barbara with Dr. Gross from Surgical Arts on State. Thank you for joining me.
Thanks for having me.
So you have this incredible new facility that you opened a few years ago, and why don't you tell me a little bit about it?
Well, I've been in Santa Barbara for about 23 years, and I was practicing by the hospital most of that time, and I bought this property to develop it into a women's plastic surgery center.
So why should somebody look for an American Society of Plastic Surgery board certified surgeon?
Well, the ASPS is very careful to certify people only who are fully trained in the broad spectrum of plastic surgery.
Is there a procedure that you specialize in?
Well, I like to think that I'm specialized to do plastic surgery on all parts of the body. That's the hallmark of a true plastic surgeon who uses the aesthetic sense and plastic surgical techniques to get good results everywhere. My focus is to make people happy, and I talk to people, I find out what it is that they're trying to achieve. Sometimes that will require a surgical intervention, sometimes not, but I try to specialize and focus my treatment to make people get the results they're looking for.
Dr. Gross, if somebody is considering having a cosmetic procedure done, what tips would you give them in their search for a plastic surgeon?
Well, they should do their homework first and find a plastic surgeon who's certified and respected. There are lots of good plastic surgeons in Santa Barbara, but it's important to find someone who you're comfortable with, somebody who has the visions that you have to make the improvements that you would be comfortable with. If someone's interested in having a cosmetic procedure, they should call the office. We'll give them an appointment and they would come in so we can talk. We don't charge for consultations. I think it's important somebody gather all the information, see what it is we have to offer. If our visions of how they would like to improve themselves match and they feel comfortable, then we can schedule their procedure.
I was wondering if you could tell me what that experience is like for you in dealing with your patients and the kind of feedback that you get.
It's always gratifying for me to see when a new review comes on that people are happy, because ultimately that's what I want to do. I want to make my patients happy. So the reviews, as much as they're a feedback for new patients to feel comfortable coming in, they're a really good feedback for me to know I'm on the right track with my patients, giving them what they want. Susan, right now we're in the preoperative area of our surgical center. People start here, we meet, we go over the plan, they'll get marked and meet the anesthesiologist. After that, when we're ready, we'll go through here. Through those doors is the operating room and then our very comfortable recovery area. This is where we do the procedures. In here, safety is our #1 concern.
So talk to me a little bit, when somebody comes here and then where do they go after this?
After the procedure is complete, my staff will make sure that everybody's comfortable, bring them into the recovery area. We keep people in recovery as long as they need to be there, until they're comfortable, safe, and able to go home.
Dr. Gross, I noticed that it just feels really intimate in your surgery center. The staff is incredibly warm, and I just feel like it's a very exclusive environment here.
Yes. We designed Surgical Arts to be just like that. We want it to be beautiful, we want it to be comfortable. Once you get into here, the focus is on safety. We'll do our procedures, make sure we get the results that we're proud of. From here, we'll go into recovery room, and then you stay there as long as you need to be there. We want to make sure you're safe, we want to make sure you're comfortable until you're ready to go home. I see my patients the next day, and then after that, their recovery will proceed.
Thank you so much. I really appreciate
You're
you
welcome.
spending the time
Thanks
with
for coming over.
Thank you.